Unanimous consent that the statement from the Alzheimer's Association and Alzheimer's Impact Movement be submitted for the record.
Without objection.
Thank you, Chair Murray. I wanted to start with Assistant Secretary O'Connell about, in particular, the hospital preparedness program. It's a program I've long supported aggressively, and so many others have as well. For those listening, this is a program that supports hospitals and other healthcare facilities and the providers who work at those facilities in preparing for public health emergencies. As we all know, COVID-19 has taxed the healthcare system like never before, and at various points in the pandemic, as surges have hit communities across the nation at different times, these hospitals and ICUs have been overrun with patients, most recently as a result of the Delta variant. So, Assistant Secretary O'Connell, I've got three questions. First, what role have the local healthcare coalitions, which are the core element of the program, what have those coalitions played in responding to the surges in hospital admissions?
Senator, thank you so much for that question, and you're absolutely right. The HPP program that you referenced is the only federally funded program to help healthcare systems and hospitals prepare for emergencies. So it's critical, and we've seen it play a significant role in this pandemic response. The local coalitions were very important because as we were seeing hospitals overrun with COVID patients, they were able to work with their coalition members to move patients to ICUs that actually had beds. So we did see that play a significant and important role.
Second question is, are you planning any after-action review to incorporate lessons learned from the pandemic with regard to the hospital preparedness program?
Absolutely, Senator. One of the things, as I've been out in the regions meeting with local leaders and coalition leaders, I've seen there's been an uneven use and success of the HPP program based on regional strengths, based on state situations. And so I think one of the things I'd like to do as we look at lessons learned is figure out how to have a more uniform, successful model for the HPP program.
And how about the third question? How about goals for the program in the near term?
Well, a couple of things that we've learned in the near term: the need to secure PPE within healthcare systems and coalitions. We've also learned the value of telehealth and how important it was for systems to be ready to do some care remotely. So we're going to take these near-term goals and begin applying them for longer-term preparedness.
I appreciate those answers. I wanted to move to Dr. Walensky on a broader question, I guess, about public health infrastructure. One of the challenges in the response has been building the systems that we need to track information necessary to manage everything from hospital capacity and ICU bed availability to critical medical supplies, vaccine components. You know the long list that is. The concern, of course, is that we're going to reach a point where we all start saying the pandemic's over and we move on. We've got to finally, at long last, invest in our public health infrastructure. How would you leverage any tool that we have now, especially the existing data systems that's been created for COVID-19, to ensure that we're prepared for the next major public health emergency?
Yes, thank you so much for that question, Senator Casey. My hope, and I'm grateful for the support to date for long-term disease-agnostic public health infrastructure investments that are bipartisan so that we don't find ourselves in a situation again. We need to be prepared for this, for any pandemic to come, and we need to get out of the current pandemic. As you know, this is multi-pronged in my view. We need a public health workforce that is upskilled skilled, that is trained, that is diverse as the communities from which they come. We've lost 60,000 jobs in the last decade and thousands more since the pandemic started. So we not only have to work to rebuild that public health workforce, but actually to skill it up in ways that can be empowered to prevent the next pandemic. Laboratory infrastructure is going to be key. We've built up genomic sequencing. Now we're doing tens of thousands a week. This was something that we weren't even doing much of prior to the beginning of this pandemic, but we again need the workforce, we need the machinery, we need the tools and the collaborations with our public health labs in order to place these all across the country. And then, of course, data monetization. We absolutely need interoperable data. We've been able to scale this up enormously over the last year during this pandemic. We have tens of thousands of electronic health records that we're now accessing in a HIPAA-compliant way, where we were doing just 100 before this pandemic. It needs to be interoperable, and we need to invest in it. We, to get a full-scale hospital system up on Epic, for example, is over $1 billion for a single health system. So when we scale that nationally to what we need for our public health workforces across all of our states and territories and tribes and localities, the investment is so very needed. Thank you.
Thank you, Doctor.
Thank you.
Thank you, Madam Chair.
Thank you. Senator Cassidy.
Thank you all for being here. Dr. Walensky, couple things. As I walked in, I came in late. Either you or Dr. Fauci were saying that the reason that we're not saying that natural immunity is protective as is a vaccine, even though there's recent publications showing that 6 to 8 months out, 92% of those with natural immunity have T cells, B cells, and antibodies that would be considered adequate to protect.